Hello.
Hello.
My name is Debbie. I'm going to be your nurse practitioner today. I was just going to do a head-to-toe assessment on you, if that's okay.
Okay.
Okay, I'm just going to wash my hands and put some gloves on. Okay. Alright, so just generally looking over her, she looks appropriate for her age. She looks clean. No obvious deformities or lesions. Skin color looks good. Let me check your skin. Skin looks good, clean and dry. Let me check your nails, no clubbing. Skin turgor is good on both, and capillary refill is less than 2 seconds. So that is good. Okay, with my gloves on, I'm going to assess her scalp, checking for any lesions, any deformities. Everything feels good, symmetric. So that is good. And just looking at her, I'm just going to have her make some faces to check cranial nerve 7, the facial nerve. So smile, frown, puff your cheeks out. Good. And so that's all intact. Okay, I'm just going to feel her sinuses for any pressure or tenderness when I'm pushing. Any pressure or any tender? Okay. Okay, that's good. I'm going to check her trigeminal nerve just by touching this cotton on her face. Do you feel that?
Mm-hmm.
In all 3 places?
Yes.
Okay, and if you could just clench down. Okay, so trigeminal nerve is intact. So that looks good. I'm going to go to her eyes. Let me see here. Grab a pen light. Okay, if you can just look at me, and we're gonna I'm gonna cover the same eye, and we're just gonna check peripheral vision. Okay, so cover this eye. Okay, and tell me when you can see my hand.
I can see.
Okay.
I can see. I can see it.
Okay, and other eye.
I can see it. I can see it. I can see it.
Okay, good. And we're going to check ocular movement. So this will be checking 3, 4, and 6. So this is checking 3. Good. Okay, so, and then we're going to check trochlea, which is looking down, cranial nerve 4, and abducens looking cranial nerve 6. So that looks good. Okay, I'm just going to shine a light in your eyes, checking your pupils for constriction. Okay. And the other pupil constricts, so that is consensual. And I will check your accommodation. You follow my finger? Good, so pupils are equal and reactive to light and accommodation. Her eyes, her eyelashes look good with no deformities. Eyebrows and eyelashes look good. Sclera is white. Conjunctiva look normal and pink and moist. No redness. From here, I will move on to your ears. If you could just put your hair. Thank you. Okay, so I'm going to check the ear. The structure looks fine. No drainage, no redness noted. I'm going to grab the auricle, the tragus, and the pinna. Any tenderness?
Nope.
Okay. All right. And I'm going to just whisper something in this ear if you can cover. And I'm going to tell you something.
Today is Monday.
Okay, and this ear?
It's beautiful out.
Good job. Okay. So that her hearing is intact, so that is acoustic nerve, cranial nerve 8. And now I'm going to assess her nose. If you can just look at me right now, it looks symmetric, no drainage. If you could hold one side and inhale. Good. And the other side. Good. So it is patent. No issues there. Any problems breathing? No? Okay. So that looks good. I'm going to go to her mouth. Okay. If you can just look at me. Her lips look fine. No bleeding, no dryness, no cracking. So that's indicates she's healthy. If you could just open your mouth. Mucosa looks good, pink and moist. Her palate, her buccal mucosa, tongue, everything looks good. If you can say ah. Okay, so that's checking her glossopharyngeal nerve. And if I had a tongue depressor, I would stick it in, and that would be checking her vagus nerve. And if you could stick out your tongue, and that will be checking cranial nerve 12, and stick it to the side. And the other side, good. Okay, and I'm just going to turn the light off.
It is getting a little dark.
Okay, that's a little bit better. Okay, So as far as her mouth assessment, everything looks good. Her nerves are intact. I'm going to go to her neck. If you look at her trachea, everything looks symmetry. There's no masses or deformities noted. Her trachea, any tenderness?
No.
No? Looks fine. And I feel her carotid pulse. Good. Yeah, check them separately. I'm going to assess her spinal accessory, cranial nerve 11. Lift up your shoulders. Good. Turn your head to my hand and this one. Good. I'm going to also assess her lymph nodes. So pre-auricle, post-auricle, occipital, submandibular, submental, clavicular, the deep clavicular chain, and her supraclavicular. Any tenderness?
No.
Okay, so that looks good. I'm going to take a listen to your carotid. Make sure there's no thrill. Okay, and listen with the bell. Okay, that looks good. We're going to move on to the respiratory assessment. She is breathing at a normal rate, regular, the depth is normal. As far as her chest assessment, the diameter from the front to the back is normal. She has her apices of her lungs here, her carina in the middle where the bronchus break, and the costal angle is in the front here, should be about 90 degrees, okay? I'm going to just take a listen. You can just take some deep breaths. And then I'm going to listen to her laterally, and which would be her right mid lung over on this side. And listen laterally on this side. Good. And take a listen to the back on the skin. Okay. Okay. One sounds clear to auscultation. And I'm just going to check the back, your skin, for any lesions or any, thank you. Any tenderness?
No.
Okay, I'm just going to check your costovertebral angle, just a little tap to the back. If you have any tenderness, let me know.
Okay. Nope. Okay. Nope.
Okay, so that looks good. All right, so now we'll move on to your cardiovascular assessment. I'm just going to inspect, make sure there's no heaves or thrills, palpate, make sure there's no kind of thrill or bruit or anything. So that looks good. And take a listen. I would listen with the diaphragm and the bell. So first we're going to be on the right border, second clavicular, listen to the aortic valve, over to the pulmonic, listening to Erb's point, the tricuspid, and the apical. The mitral, which is the point of maximum impulse. Okay, so I hear regular S1, S2, and listen with the bell. Make sure there's no murmurs. Okay. And I'm just going to check your pulses. Okay, you can just give me, yes, your radial. Feel your radial pulses. Your brachial. They feel normal. Your popliteal. Dorsalis pedis. and your posterior tibial. All pulses feel equal, regular. Okay, and if you would like to lay down, I'm going to check your abdomen. Okay, move this stuff. Okay, so first I'm just going to inspect. No obvious deformities, stomach is flat, no distension, no masses, color looks good, and I'm just going to auscultate next. From right upper to left upper and then to the lower quadrants. Okay, bowel sounds are positive, sounds normal. I will now just percuss. And we're just going to start percussing, listening for tympani. Okay, so that sounds good. And now I'm just going to palpate your abdomen, just lightly. Any tenderness or pain? Good. And I'm just going to do a little deeper. Any pain?
No.
Okay, and then we're just going to find the liver border. And if you could just take a deep breath, and I'm going to try to hook your liver. Deep breath in. Okay, any pain, tenderness?
No.
And then the spleen. Deep breath in. Okay. Okay, so everything looks good on the abdomen. If you would like to sit up. Okay, so we're just going to do a musculoskeletal assessment. If you could stand. All right, and if you could just lift up your shoulders, down, and against my hands. Good. And then abduct your arms. Good. And pull them back down. Good. So strength is good and equal. Pull up your hands against the pressure. Good. And down. Good. And we'll check your wrists. Flex. And yep. Good job. And if you could, you could put your hands. Let me see. Actually, just go like this with your fingers. Good. And then close them against my pressure. Open. Good. Okay. So strength is good. If you could just lift up your knee. Good. So flex it, and then extend. Good. And down. And then back. Good. And then and rotate the same leg. Good. And then back around. Good. And then flex, extend, back down, and then back. And then, yep, rotate in and out. Good. She has good range of motion. If you can just flex your foot, plantar flexion and dorsiflexion. And if you can do it with the other foot. Okay. And then go ahead and scrunch your toes up. Good. Your torsos and the other one. Good. Okay. So if you could also bend, or before you bend, just looking at her spine, it looks straight. No kyphosis, no lordosis. If you could lean forward. No scoliosis present. The spine looks fine. No, no bulging or anything, so that's good. Okay, you can come back up. And we're just going to do a neurological assessment. I want to tell you 3 words, and then at the end of the assessment, I will ask you to repeat them to me. Pillow, house, dog.
Okay.
Okay. And right now, I'm just going to assess her Romberg, which is closing her eyes for 20 seconds. See if she drifts or anything. She's doing pretty good. 20 seconds is up. No problems there. So good job. If you could check for coordination, touch your nose. Good. And then the other one. Good. And then put your hands on your lap and clap. Good. Faster. Faster. Good. Good job. Okay, I'm just going to feel a sensation with a cotton ball. Just tell me if you feel it.
I feel it.
And here.
I feel it. I feel it. I feel it.
Good. And if you could just walk to me, regular, and tandem walk, so one foot in front of the other, back. Please tell me those words.
Pillow, house, dog.
Good job. Okay. I thank you for your time, and that's the end of the assessment.
All right, thanks.
Thank you. Wash my hands.